We are the largest ophthalmology optometry group in Fayetteville. We handle the most basic of eye care problems to the most complex eye care problems. We're all trained in the most advanced techniques in cataract surgery to refractive surgery to retina and cornea and glaucoma. There are 3 of us in our practice that do refractive surgery, myself, Dr. Penmatcha, and then Dr. Patel and Dr. Riggins. So 3 of us do the procedure. Now the first thing is, what is LASIK? LASIK stands for laser in situ keratomylesis. To understand what LASIK does, we're just going to go over a little anatomy of the eye. So this is what the eye looks like. Now this right here is the cornea. That's the lens, and this right here is the pupil. And the colored part of the eye is called the iris. And this is the retina, and this is the optic nerve. So light goes right through the cornea, through the lens, it focuses on the retina, and it gets transmitted to your brain, and that's how we get vision. Now, for each one of you to be here, you're interested in LASIK, so you must have some problem with either needing glasses or contacts to see better. So you're probably either nearsighted, farsighted, or have an astigmatism, or a combination of the 2. So if you're nearsighted, it's also called myopia. Oh, let's go back here. Myopia. So what really happens is, in nearsightedness, like in a normal eye, the light rays go in through the cornea and get focused right on the retina, and so you get a clear vision. What happens in nearsightedness is that the light gets focused in front of the retina rather than right on the retina. The eyeball is kind of a little long. It's like the axial length is a little long, so the light is focused in front of the retina. That's why people are nearsighted. Now, hyperopia, or farsightedness, what happens is that the light, instead of getting fixated, focusing on the retina, gets focused behind the eye. The eyeball is a little short, so that's why people need glasses also, or contacts, to refocus the light rays onto the retina. Now, when you have an astigmatism, you're really blurry in all distances. And the reason why is that the cornea is supposed to be shaped like a basketball. Well, it's more shaped like a football, so the light rays come in and it's kind of like a blur coming into the retina. So what LASIK does is really reshapes your cornea to do what your glasses or contacts do for you. So what we do for LASIK is basically we make a small flap on the cornea. It's about 1/10 the thickness of a millimeter. That's how thin it is. And it can be done with a blade or a laser. So we make a little flap, and it's painless when we do it. And then we use the laser, and it reshapes the bed of the cornea. And then what we do is we flip the flap back over, and voila, then you're out of glasses and contacts. So a lot of people ask us, how do we tell if a person is a candidate? The first thing we do is we do a completely thorough eye exam. It's one of the most detailed eye exams possible. We look at everything, because the eye has to be healthy for us to do it, and also to get a good outcome. And we have to make sure there's no underlying disease or anything like that. We also check your prescription for glasses, because the lasers have FDA protocols on how much prescription we can do that have been FDA approved, so you have to be within those parameters that the laser can do. We also take a look, what's called a corneal topography. It's kind of a color map of your cornea, to make sure that has the right shape, because if it's too steep, it's dangerous to do the procedure, and we can tell that from the technology that we have. And we also have to make sure that you have enough corneal thickness, because when we do reshape your cornea, we have to have a certain amount of thickness in your cornea. So we do check that. And we also check your pupils and dim illumination, because if your pupils are really wide, some people might have some problems with night vision, but that now is less of a common problem, because now we have new technology called Wavefront LASIK that can kind of actually make that better, get people to see better in night vision. Now, when is LASIK not for a person? Now, if your glasses prescription has been changing year to year, more than like a half diopter, then you probably want to wait until it stabilizes. If you're under the age of 18, it's not FDA approved, so you have to be above the age of 18. Now, if you're participating in like contact sports like boxing, mixed martial arts, where you're going to get hit in the eye, you might not want to choose LASIK because you don't want anything to happen to the flap. But there are other procedures like PRK or LASIK that I'll be talking to you about that you could have done if you're doing those type of sports. Now, if you have autoimmune diseases like lupus, rheumatoid arthritis, Sjogren's disease, those are not candidates for LASIK because it affects their healing, and also you can have other problems like really bad dry eyes that are pre-existing. Now, if you take certain medications that affect wound healings like Imitrex, Accutane, retinoic acid, and brimonidine eye drops, that's something you would have to stop before you could do the surgery. Now, if you had a history of herpes infections of your eyes, that will be a contraindication because you can always get a recurrence after the surgery. If your corneas are really steep, like it's called keratoconus, that is something that we wouldn't do. If you have diseases such as glaucoma, that would be something that we'd have to talk about because it does affect the pressure readings after doing the procedure. And if you have thin corneas or really bad dry eyes, and if you're pregnant, that's something that we would wait until after the pregnancy to take the measurements. Now, the most important thing out of all these is really having realistic expectations. Now, one thing that we want to make clear is that you will not get X-ray vision from this. And and the most important thing is that there are people that we do refractive surgery on that were like, say, 2400, and then we get them to 20/20, and they get, hey, I'm still not seeing clear. If you're one of those patients, I'm going to make sure Dr. Patel and Dr. Riggins do you. Okay, so if you're not a candidate for LASIK, there are other procedures that give the exact same results as LASIK that you could be a candidate for. One very good procedure is called PRK. In LASIK, what we're doing is we make a little cut in the cornea that's 1/10 the thickness of, essentially 1/10 the thickness of a millimeter, and do the treatment and then put the flap back on. In PRK, what we essentially do is we don't make a flap, we just basically use the laser to reshape the surface without making a flap. The results are pretty similar, exactly like LASIK. It's just that there's some discomfort associated with it, and it takes longer for the vision to come back. That's why LASIK is a little more popular because of that. Now, another procedure that we can do is called LASIK, also known as laser epithelial keratomalesis. And what we do with this is basically we have this little well and we put 20% alcohol and let it sit there for 30 minutes on your cornea. And then the skin layer on the cornea is loose, so we can just slide the skin layer across the cornea and do the same thing as LASIK, reshape the cornea, and then put the skin layer back on. This also carries the same results as LASIK. It's just that there is some discomfort and it takes a little longer for a person to heal. So when we do a LASIK consult, we look at all your measurements and all your data, and then we come up with the best plan to make it safe as possible and also giving you the best chance of an outcome. Now, if a person their prescription is way outside the parameters of the FDA guidelines on what we can do for LASIK, we can also do what's called clear lens exchange. What we're really doing is doing cataract surgery on somebody and just removing their lens and then putting an implant in. So this is another option for people that wouldn't be candidates for LASIK. And this procedure has fallen off the wayside because we have better procedures now. This is called conductive keratoplasty, where we make little scars in the cornea to reshape the cornea, but not many people do this anymore because LASIK and LASIK and PRK are much more accurate. And this is an older procedure called RK. These are kind of all the types of procedures available, but this is not very accurate and it's not very stable. It's something that was done in the past. So what we use here at K-Fear Eye Associates is the most advanced technology available. It's called the ILASIK Platform. And what it is basically the ILASIK Platform is composed of 3 units of technology that each are vital to give the most optimal outcome that any technology could provide. And I'll go over each one of these. This is called a wave scan. This is called the interlace. This is what actually is a laser that makes the flap rather than a blade, which a lot of practices use. And this is the Vissx S4 laser. And I'll go over each one. So the ILASIK platform really is the most advanced technology, and also it has the broadest range of FDA approvals out there. It can provide a customized treatment to get more patients better than 20/20 and improve their quality of vision. There's been over 15 million people worldwide that have had this done with this platform. It has the broadest range of FDA approvals than any other laser system out there, and it's trusted by NASA and the U.S. military for their candidates. Now, there are two ways of doing LASIK. One is called conventional LASIK, and the other one is called custom LASIK. And conventional LASIK is a wonderful procedure, and what it does is basically treats what your glasses and contacts do for you. Now, we do both conventional and custom. We evaluate you and try to decide on which one is best for you. Now, custom LASIK basically not only does it do what your glasses and contacts do for you, but it also basically treats the imperfections in your optical system to not only give you good vision, but it can also get you beyond 20/20 vision, and it can also improve the quality of your vision further than sometimes glasses or contacts. So this is the first part of the ILASIK platform is called a wave scan, and this instrument, what it does is it sends a light ray into your eye, and the light rays bounce back. And what it does is it picks up all the imperfections of that light ray as it goes into your eye and back in your optical system. And those imperfections are called aberrations. And what this does is it maps it out, and it tells the laser how to treat all those imperfections. And this is something that glasses or contacts cannot do for you. So that's why we can now get a lot of people further than 20/20 and also increase their quality of vision further than what glasses or contacts can do. So what Wavefront LASIK does is it gives you a better chance of getting achieving 20/20 vision, and also a better chance of even getting further than 20/20 vision, and also gives you a better chance of not losing a best corrected vision of what your glasses and contacts do for you. And the most important thing is it improves your quality of vision, and it also reduces your chances of getting night vision problems or glare. Now, I don't know how to get this thing. Okay, there we go. So this is what the wave scan looks. We put you through this instrument. It scans your light, so it shines some light into your retina and then back out and takes the map of all the imperfections of your eye. It sends it to the laser, and it tells us what to treat. And this is how it goes. The light goes in, it gets back, and it reads all those imperfections of your eye. Now, the next thing that we're going to talk about is what makes the cut in LASIK. Now, a lot of practices use the blade, and then the other alternatives using the laser. Now, there is no substitute for the laser. It is much safer, and every aspect of it gives you a better chance of getting a better outcome. So, the intralace is the instrument that's used to make the cut in the cornea. It's painless when we do it. It makes stronger flaps. You get improved wound healing. It's more predictable in the sense that if we want a 1/10 millimeter flap, it'll give us close to that. Whereas a blade, if you ask for a 1/10 millimeter flap, it may give you a 2 millimeter flap. So it's much more accurate. You get a faster recovery. And the nice part about it is we can make thinner and thinner flaps to preserve more corneal tissue to improve the biomechanical strength of your cornea. And it's clearly safer. And another advantage of the laser is that it can make any type of flap we want. We can make a square flap, we can make a circle flap, we can make an elliptical flap. So at K4 Eye Associates, we always make this elliptical flap, and the reason why is that all the studies show that it is, once you make it and you put it back on the cornea, it is much more adherent and stronger, and your cornea retains a lot more of its strength than other types of instruments used to make the flap. Now this is just showing the comparison of a laser making a flap and a blade making a flap. You can see a common instrument used to make a flap with a blade is called the Amadeus keratome, and the laser the studies were done, and it shows that it's 3 times stronger if you use a laser flap. And also, if you look at from 1 day to 3 months, this is a blade making the flap, and this is the laser making the flap. You can see that the recovery time in every aspect from 1 day to 3 months is much faster with the laser. And the most important thing of all is that the complication rate is so much more reduced with a laser doing the flap than a blade. Common problems when you use a blade is you can make holes in the flap. They can be decentered. You can get corneal abrasions. You can get irregular flaps, which the laser is clearly much more safer. Now this is called the Vuzix S4. It's the actual laser that reshapes the cornea and actually does the treatment. The Vuzix S4, compared to any other laser, has the broadest range of FDA approvals as to what we can treat. So we can treat up to minus 14 diopters of nearsightedness, and Wavefront you can go up to minus 11 diopters. Very few lasers are able to get to those parameters. Now, so with custom Wavefront guided laser treatments, you can see right here, if you're a low to moderate myope, 74% of the people that have had this treatment get 20/16 or better at 6 months after the surgery. If you're a very high myope or very nearsighted, 65% of the people get 20/16 or better at 6 months. Okay, now another thing about our laser which improves the quality of the treatment is that a lot of lasers use what is called a broad beam laser, where it's just one big beam that reshapes the cornea. Our laser does what's called variable spot size, so it gives you different spots as it treats to make a much more smoother ablation, so the quality of vision could be better. And our laser also does what's called iris registration. It takes a picture of your, the wave scan will take a picture of your iris, and then when you're under the laser, it actually maps out the laser image and that picture that the wave scan did, so it'll align all the treatments with the iris readings. I don't know why it's not working. All right. And this is just showing the iris registration. So the laser will lock on to things that it reads on the iris. So when we lie down flat, our eye tends to rotate a little. It's called Cyclo Torsion. Our laser basically tracks all that, so the treatment that you get will be precise. So some lasers don't do that. So what happens is if your eye rotates about 30 degrees, that's what your treatment will end up looking like after the procedure. And this is just 1 degree, and to see how it's not that clear. So our laser, before it can actually treat, it would have to lock on to all the targets before it even do it. And then, so basically this is the summary of the ILASIK platform. You get a greater chance of achieving better than 20/20 vision. It's safer. You get a faster recovery. It has the broadest range of treatment parameters that the FDA approved. There's been over 15 million procedures performed worldwide. And really, you have the best chance of getting the best outcome.
These two are patients of ours who have undergone the procedures. Mr. Howard had ILASIK with us, and Mr. Guzman had PRK. So I would like for them to share with you guys their experience with KPRI, the doctor, the staff, also the actual procedure, their healing time, and answer any questions that you might have coming from a personal experience.
My name's Rick. I did have the LASIK surgery in December 2014, so I'm still in within the 6 months healing process, but I can tell you guys that it was amazing. The process itself probably didn't take longer than 15 minutes. Didn't feel anything really, maybe minor pain, but overall I had no issues. And I've come in for my checkup appointments, and I've been told my eyes were a little dry, but I work on computers, so constantly told to make sure I take my drops, and I have been, and now I need them less and less, so it's a good procedure.
I'm Mr. Guzman. I had it done in December, and everything that the doctor covered, it was almost the question of the medication or the surgery. I was kind of scared doing it first, but after you go through the procedure, it's easy. I didn't feel anything at all. The only thing that bothered me was just keeping the eye open. And I didn't know what to expect, but it was everything like he's saying at the beginning. As long as you go with the medication, taking the drops like him. My eyes was always dry. Now I'm taking some drops all the time. It's getting back to normal, and I like it. Before I used glasses to read. I use no glasses at all. I'm in the computer all the time, and it's to me it was like a miracle because I can. It's taking me a little while, like it was in December, me too. So I can feel it back and forward after the surgery. At the beginning, for me, was like 2 weeks. I can see closer, and then went away, and I can see far away. So it's gradually. I'm desperate to get it where it's supposed to go, but I'm happy with what I got right now. So if it's gonna get better, it's better for me. But at the same time, I'm happy with it.
All right. Does anybody have any questions? I know you asked about healing time. I was laying down on a table when they did procedure. When I sat up, I could already see. It was a little blurry because it just finished. But by the time we went to Bojangles after we left here, I could see all right when we got to Bojangles.
Oh, that's all right.
Wow.
So you're not going to be blind, but you do have to wear these goofy glasses for about a week when you go to bed, and so you don't rub your eyes while you're sleeping. Other than that, you won't be embarrassed.
Yeah.
Oh yeah. Nobody wants to be near you when you're wearing those glasses.
Yeah, when you leave from here, you feel like when you go to get your eyes dilated, like for the first day, and after that, like he said, you wear these glasses like you're skiing when you go to sleep, so you don't do this. But it's after a while, you feel comfortable. You can take them off and you kind of control yourself. But
Did you wear glasses before?
I did. You can actually still see the scars from my misfitting glasses.
see, the thing with the glasses, the reason I got mine done is like every 2 years, year and a half, going to see it, getting new glasses, and always, the drill on your nose and stuff like that. So that, no more. So.
You had a question, man?
Just about driving. When are you able to drive normally?
Typically, with LASIK, most of our patients are able to go back to most of their functions the next day. Of course, we always tell you to wait until you see the doctor before you start driving and doing things like that. With PRK, downtime is about 5 to 7 days. While your cornea is regrowing and healing itself, it does take a little bit more time to adjust to the vision and to get to the point where you can see to drive a vehicle. You can still see, but it's blurry
3D.
while it's healing.
You said you continue to use the drops.
I do.
How many?
I use 2 today.
Are they
one in each eye.
Pataday, what?
What's that? I'm sorry.
Are they like Panadol or
It's
Panadol?
artificial
They're-
tears.
Yeah, they're
Oh,
preservative-free
okay.
artificial tears.
Oh, okay, so they're not like medication.
No, they're not prescription.
Oh,
No.
okay.
There
You can get
are
them.
medications that you do use after the surgery. There's a steroid and an antibiotic that you use for a week. With the PRK, you are on one of your medications for a little bit longer, just while you're healing. But the artificial tears you do experience with laser surgery, you'll experience some dryness. Some of that dryness with every patient is a little bit different. Some people get over that dryness after 6 weeks, a couple months, and some people it takes a little bit longer. But the initial healing time, first few weeks, we want you to be on those artificial tears. They're your best friend. It does help the healing.
So we will be stopping the artificial tears.
Eventually, yes.
Okay, cool.
Yeah.